Really pleased to have everyone with us today for Comcare's information session on licence fees. I'm Sarah Stanchev. I'm the Director of Comcare's self-insurance team, and I'll be your host for today's event. And thanks very much for coming along. We'll kick off, and firstly, I'd like to acknowledge the traditional owners of the lands on which we are virtually meeting today. I'm joining you from Canberra, and I'd like to acknowledge the Ngunnawal people as the traditional custodians of the ACT. I'd like to pay my respects to their elders past and present and acknowledge the contribution they have made and continue to make. I also extend that respect to other Indigenous Australians and Torres Strait Islander peoples who are present. So before we begin, I'll just go through a little housekeeping. This session is being recorded. However, only myself and the presenters and slides will be captured in the recording. The recording will be made available on Comcare's website in the coming week, and we really encourage you to share it. You will notice your microphones and cameras are not able to be turned on. However, the chat function is enabled, and we encourage you to participate in the conversation via the chat, and this won't be included in the recording. As always, we ask that you keep it respectful and on topic, and we know that you will. If you are using the MS Teams app, there are instructions on the screen now on how to turn off chat notifications during the session, which otherwise you might find a little distracting. I'll also point out now, we would really appreciate it if you can stay till the end of the session so we can share a link to the feedback survey. It will be emailed to you, but you might find it easier to just complete it within the session. So with that, we'll get started, and I'll hand over to Mick Duke, Comcare's General Manager for Scheme Management. Take us away, Mick.
Thanks, Sarah. Appreciate that. And welcome everyone to the session that we're running today. I'd like to thank you all for taking the time to come along and discuss the important topic of licence fees and basically walking through how we approach cost recovery and licence fees within the Comcare scheme. So also thanks to the SRCLA leadership and the members of the licence fee working group who both were supportive in development of the material for today's session, but equally encouraged us to run the session because it's been pointed out that there could be some gaps in terms of understanding around cost recovery and licence fees. So thank you to those people. So today's session, we are going to focus on an introduction in broad terms to cost recovery and Comcare's cost recovered environment. We'll provide an overview of licence fees. We'll address some of the key themes and trends that are impacting licence fees, and just highlight some of the key steps in the process, in particular, some of the key dates that you need to keep in mind as part of the licence fee process. So presenters today, obviously Sarah's assisting with the MC duties. I'm Mick Duke, the General Manager of Scheme Management, and I have responsibility for a range of topics, but one of those is the cost recovery element. And we also have Hansen Chen, who's the Director of Premium and Cost Recovery in Comcare. And Hansen will introduce himself shortly. So in terms of Comcare and self-insurance under the SRC Act and how we, go through our process for cost recovery, etc. Comcare implements, it's very much based in our legislation. So Comcare implements cost recovery for its functions under the SRC Act and the Work Health and Safety Act. Comcare is a fully cost recovered agency, and what that essentially means is that all of our activities are funded either through the fees that are charged to licensees or regulatory contributions that we charge to our premium paying sector or our Commonwealth sector, and premiums as well. We also use our premiums not only to cover the cost of the workers' compensation claims that we're managing, but also the administration attached to that. Comcare does not receive any large amounts of appropriation from government. We do receive some small appropriations from government. Typically, they relate to functions such as the Sea Care Authority, the asbestos claims management function that we do, and a little bit to do with work health and safety. But that's, in the scheme of things, quite small in comparison to the amounts that we recover related to our premium function and the amount that we recover related to the SRC Act scheme management and work health and safety roles. Comcare has a national presence. It's probably a good place to sort of start to be aware of sort of what, when we're recovering costs, what you need to be aware of. Obviously, we have a national presence with offices in every state and territory. We currently have approximately 650 staff across the country and across all the functions, including our claims management, work health and safety regulation, scheme management, and our corporate areas and legal areas as well. So in very simple terms, license fees are in essence used to fund all the work that Comcare needs to do, along with those other sources of revenue that we charge as well. So basically, anything that we do, we need to recover as part of this process. If we jump to what are license fees and why do we charge them? Well, Comcare charges license fees for three broad categories of functions. So this is very specific to the license fee element, just to be aware of this. I'm not going to address elements of premium, etc. So those three functions broadly relate to the SRCC and support of the Commission, the Work Health and Safety Act, and the SRC Act. So what are license fees and why do we charge them? Well, again, SRCC functions, and on the slide you'll sort of see we've broken out a little bit about the elements of each of those buckets. So the SRCC functions are undertaken by the Commission, and it includes ensuring the quality of outcomes of the licensees, regulating those licensees, any advice and assistance that the Commission might need to provide to the Minister, issuing of guidelines, of which the Commission does do and does issue guidelines to Comcare to follow, the granting of self-insured licenses, extending self-insured licenses. These functions of the Commission are all funded by license fees. There is a small element that is also funded by regulatory contributions because the Commission does also have a role over the premium paying sector to a very small degree. So an element of the functions of the Commission are actually charged to our Commonwealth colleagues. And we also obviously recover money related to license fee applications through the license application process as well. So licensees don't pick up the tab related to a license fee application. It's the actual applicant who will pick up the costs associated with that. The WHS functions, these include obviously monitoring and enforcing the Work Health and Safety Act, so the compliance elements attached to that, but also the education and training work that we do under that Act, publication of WHS activities and information and sharing that information across the jurisdiction. Many of you will know that approximately 29 of our 39 licensees are actually covered under the Work Health and Safety Act. So they will receive charges related directly to that work health and safety role. Our SRC Act activities, this is broadly the scheme management role. So that includes a range of activities that we do. That includes the data work that we might be doing, research that is conducted by our strategic partnerships and engagement area. That research ranges on a range of prevention and compensation issues. It includes the work that we might do in terms of liaison with other bodies such as Safe Work Australia, the Department, DVA and other entities, and also goes to the work that we do around the promotion of better practice in rehabilitation, claims management, workplace rehab provider monitoring, and the forums and education pieces that we might do that sit off the Workers' Compensation Act and the SRC Act. So both the WHS and the SRC Act activities are, in essence, funded through license fee and regulatory contributions. And the regulatory contributions are the way in which the methodologies in which we use to charge regulatory contributions is exactly the same as the one which we use for the license fees. So in essence, the Commonwealth is cost recovered in the same way, and so it very much hinges on the methodology, which Hanson will go through very shortly. So that is in essence the overview of why we do it. It's very much based in our legislation, and the requirement for us to do it is very much based in the fact is that it's primarily our funding source, along with our premium element. So I might now hand you over to Hanson Chen to take you through the next part, which is around how we calculate fees.
Thanks, Mick. Good morning, everyone. I'm Hanson Chen, and I'm the Director of Premiums and Cost Recovery at Comcare. It's lovely to see so many of you here for this webinar. I'll pick up from where Mick left off and focus a little bit more about the fees themselves, starting with how a license fee is calculated. So essentially, the fee has two main components: an ongoing component that reflects a share of costs that are not directly attributable to any specific self-insurer, and a set of variable costs that are directly attributable to activities such as inspections and investigations. The ongoing component is allocated in two ways, depending on the function the cost relates to. Each licensee is charged an equal share for the costs for the activities related to SRCC. This was just under about 150,000 per organization in last year's license fees. For activities that are conducted under the SRC Act and WHS Act, these are charged on a FTE basis, which is relative to the size of your organization. For variable charges, these are applied on an as-use basis, reflecting the level of activities directly attributable to each organization. Every year, we also publish a cost recovery impact statement, and that document is updated annually, outlining the composition of these charges in more detail. This statement can be found on the Comcare website, so if you'd like to explore these costs in a bit more detail, that's where you would find that information. Now, a little bit about the total fees that were collected in the last round. So for 23-24, we collected 22 million across all licensees, and that consisted of 19.5 million in ongoing costs, so that's about 89%, and 2.5 million for variable charges, which is around 11%. I do want to note that from year to year, because the activity will vary, the total figures for variable charges can change from year to year, depending on the regulatory activities undertaken by Comcare. So a little bit about the key trends that could impact fees. I do want to note that this list is not exhaustive. There are other things that can obviously impact fees, but these tend to be the key ones. The first one is inflation. As you may be aware, we're in a fairly inflationary environment. The impact of cost of goods as well as services utilized, as well as the wage of staff, would create upward pressure on the license fees. But I also want to note that fee increases over the last 10 years have usually been below inflation rates. Projects and capability uplift activities also have a direct upward relationship with fees. These also tend to be a little bit lumpy, and that can also add to the volatility of fees, particularly in the absence of retained funds to draw down on to cushion any kind of additional effects. The third item in that list is methodology. Changes to methodology, depending on what it is, can have an impact. An obvious example would be a move towards identifying more variable means of charging licensees. Obviously, that would create an allocation of fees to specific users of these activities. Now, this would not necessarily result in an overall increase, but a reallocation amongst existing payers. The final two things, the first of which is more licensees. So the number of licensees, in particular the FTEs, will determine how the ongoing fees are distributed across the pool. Obviously, if you have more licensees, then each individual licensee will receive a smaller share. Similarly, if you have an exit of a licensee with significant FTEs, that will likely cause an increase in license fees for those who are remaining, because the organization cannot adjust quickly when licensees come in and exit. Finally, as you may be aware, there are some recent legislative changes that has brought with it a need for Comcare to ensure that the changes are implemented effectively. So this means Comcare will require more resources to perform its functions, and this will also be partly funded through license fees. So move to the next slide. Finally, I wanted to have a chat about the cost recovery review. As you may be aware, in 2023, Deloitte completed a review of Comcare's cost recovery process. Now, whilst that review concluded that Comcare's cost recovery process is fit for purpose, there are a number of areas where they've identified improvements can be made. These recommendations covered governance, methodology, stakeholder engagement, and compliance. Improving governance was identified as the top priority, followed by improvements to the methodology, stakeholder engagement, and compliance. We have already started working on some internal improvements to the governance and engagement, particularly with internal stakeholders. We'll also visit broader recommendations for engagement and compliance in the second half of this year, noting that the scope of the review is actually broader than just self-insurance, and a lot of the recommendations, particularly for engagement, relate to the CCare scheme. Some of the more complex changes around methodology will necessarily take longer to assess and implement. We will, however, look at them at the earliest opportunity and discuss any details and potential changes that will impact license fees with you well before any kind of implementation. So broadly, the work on improving Comcare's cost recovery process will continue into the next cycle as we assess the impact, consult relevant stakeholders, including yourselves, and then implement those recommendations where it is appropriate, economical, and feasible to do so. And here are some target dates to keep in mind. We generally aim to issue the indicative license fees in April, and then the final fees along with invoices by the end of June. Payment is due within 30 days from the date of invoice. Your account managers would send information regarding variable charges to relevant licensees in September for the first half of the calendar year, and then again in the following February for the whole of the previous calendar year. Licensees also have up until the end of February to provide any updated FTE details that will be used for the calculation of license fees. So this wraps up a high-level view of the cost recovery process, and I'll now hand it back to Sarah.
Thanks very much, Hanson. So we've got on this last slide here details if you wish to contact us at any point with any specific questions about your organisation's licence fee. You can email the self-insurance team at the email address on the screen, or you can also reach out to your account manager directly. That brings us to the end of our presentation.